today. I'm Dr. Michael Kachmar, and this is Scrubbing Up with Dr. Michael Kachmar.
Yes, it is.
And today's date is January the 14th, the year of our Lord, 2022. So this is our first show for the new year.
2022, Mike. We're in the future now.
Right. We had a show that we had a problem producing. So we are here, and we are live right now.
Yeah. Well, last week's show had kind of a glitch.
Right. So anyway, I'm Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon.
Yes, he is.
I'm on staff at multiple hospitals in New Jersey. I'm on staff at Jersey Shore University Medical Center, Community, Southern Ocean County Hospital.
He's at them right now. He's brilliant at multitasking.
Right. And we have, you could want to get a hold of us. It's, you could go to our webpage, which is JerseyShoreFootandLegCenter.com, JerseyShoreFootandLegCenter.com.
For more information about what we talk about on our show. Yeah, that's
right.
a great place to go.
Right. It's a great place to go. Yeah. And if you are, on the podcast, you should go to our YouTube video. So we're YouTube right now live and also on Facebook.
Yeah.
The other place to get a hold of us is you could send us an email.
Before we move away from YouTube, platforms like that, you can subscribe to us and you can press the little bell notification. So you'll get notified whenever we do a live show. That's great if you just want to keep up to date, and you always got something to watch then, the two of us talking about crazy stuff that's going on in the world.
Right.
Like Dr. Kachmar was about to say, we're also on Facebook Live. We archive our video shows there. You can catch up on old episodes, or you can watch us live there and send your questions in, as well as YouTube and all other platforms. You can type your questions in and we'll read them in real time for you can join our show. That's what this is all about. Also you can find us on YouTube, Yahoo, Google, and everywhere else fine podcasts are found.
Right. And the other thing you get us to is our email address is drkachmar@comcast.net. You put that up?
Yes, sir.
No, not the okay, you can do the iCloud. Go to do the other one, Jeremy, not the iCloud one. You have the one that's Comcast, drkachmar@comcast.net if you don't have that. So yeah, you can go to the iCloud one then. Fine. Put that back up. So Dr. Kachmar, iCloud.com. So this is Jeremy. Jeremy, say hello.
Yeah. Hi, everybody. I'm your old pal, Jeremy. You know me. I am a director of marketing, and I specialize in medical marketing.
Chagrinery. You specialize in.
I specialize. And that's why you see me here. Otherwise,
yeah,
I don't even know what I would be doing here
at
all.
There's no side hustle, right?
Yeah, there's no side hustle. No.
So Jeremy is my sidekick. We've been doing this show for about 3 years right now, and it's a medical talk show.
Seems like more.
Yeah. I was going to talk about a lot of things today. Actually, I wanted to talk about a syphilis.
Why not?
Why not?
I'm dying.
The thing with syphilis is funny. We're going to probably do it the next show, but syphilis is it's coming back.
Oh, I gotta wait for the syphilis talk.
But you could get. The thing about syphilis though is it's really serious, and actually, from my perspective, we see some wounds that people have these lesions, but there's a big push that it's coming back and it's getting real serious. So we're going to talk about that. But let's
that's what you get for laying down with unclean women.
You could actually get it other ways, believe it or not. Yeah, it's pretty contagious.
Well,
sometimes.
That's something we all are going to be looking forward to next week is the syphilis talk.
Yeah, but I tell you what, we throw it in with when we have to have a medical show once in a while.
This is kind of like, it's going to be kind of like when the gym teacher all brings you together and he's got to talk serious for a moment.
Well, I tell you what,
we're going to talk about syphilis.
I tell you what, syphilis. They should be testing every woman who's pregnant, because there's where the problem is. The baby could get it. So, and I think there's where they do it is they test the woman, the first trimester, maybe the middle, and then the end. But anybody who's sexually active with multiple partners should be getting tested annually, at least, for syphilis. And there's 3 stages, and you could get it and you get maybe a sore or not, and it goes away. Then you get a rash all over your body, and that goes away. You could have it for years and years. It's interesting with syphilis because do
you remember when they would just refer to it as, like, the layman would just refer to it as VD.
Yeah.
But that was like that was an across the board spectrum.
Right. Well, there's chlamydia. But what's interesting about syphilis is that it's a spirochete. It looks almost like the Lyme's disease spirochete, but it's a bacteria. You could have it for, 75% of people have it and they supposedly never have any symptoms. But it can really affect the baby. And that's where you got to be careful with pregnant women. But we see it with lesions and things of that nature. What's nice about it is it's one dose of penicillin usually knocks it out.
Really? Just one?
Yeah, I think just one. I haven't treated anybody for it. And I have to do a little research. Yeah. But the thing is that when you go, if you're a young guy, a young girl, your doctor should be tested every once in a while. There's other ones too, chlamydia, and of course there's AIDS, all of that stuff. Yeah. But the only reason I bring it up is because I'm looking at my journals, and there's more and more journals coming out there seeing more and more and more of this. And it's something that you need. It's an easy blood test. You don't even have to get anything physical. And you can see actually this guy had. I'm going to talk about it next week, but he actually has a. You go on his webpage, and they'll send you a test kit for free. Or I think it's for free. And because I think they take donations, and then you could send it in somewhere and they'll tell you if you're positive or not.
Really?
If you want to do it. Yeah. It's something that, we want to throw out there. So let's talk about.
So for everybody out there harboring the thought and fear that they might have syphilis, we'll give them the answer next week.
Well, when I get people come to my office with neuropathy or a wound that's not healed for years or months, I order a whole bunch of blood work, and one of the things I order is a syphilis test.
Yeah. Is there an external way of seeing syphilis?
Well, yeah, like I said, initially you'll get a sore on your genitals right after like a couple of weeks, and it's painless. Okay. Then that goes away, and then what you'll get is a rash on your body. And that this is again, I'm just going from memory right now. I haven't researched. I was going to do the show, in depth next week.
Yeah. We'll stop now.
It's a question. Then what happens is that goes away, and then it sits in your body. I mean, it could go to your brain. It could affect your heart. Yeah. I mean, it could bang you up pretty bad. The old that movie. What was his name? Al Capone. Oh. Supposedly that's why he had dementia from syphilis. There was no cure back in the day. Oh yeah, syphilis knocked out a lot of people back in the day.
I think I knew that actually. I think I knew he died of. Didn't he die of it, or can you?
Well, I think he had dementia. I don't know what he died. Maybe a heart attack. But I'm not a. I didn't follow. I'm not a follower of the Capone.
I looked
saga.
into it for a bit though. I looked into it for a bit. Yeah. I think he died somewhere in Florida.
But he had syphilis. Syphilis was a bad one, and same thing with gouty arthritis. We're going to talk about some of the, the two things. Next show is going to be about that. So anyway, let's just talk about what's in the news, today. And
I'm going to research some Capone
stuff
too for next week.
So we're going to go to the whiteboard. We got a couple things I want to hit with
Let's go to the whiteboard.
Right. So, remember that thing? They go, where's Brandon? How about this? Where is the therapeutics? Where's the therapeutics, Joe Biden?
Let's go, Brandon.
How about like this? Where is the therapeutics, Joe Biden? Right. Where's anybody for that matter? The CDC, where's the therapeutics? FDA, where's the therapeutics? And what do I mean by therapeutics? Well, first of all, what happens now? You get diagnosed with corona, even today, right? What do they do for you? I mean, send you home. Now we have therapeutics out there. One of the therapeutics that we have when we're not really giving is hydrocodone, Plaquenil, or ivermectin. Now people say, they don't work, and there's a lot of studies coming out that are starting to put some doubt in that. But let's forget about those two. Let's not get into the argument of whether or not they're effective. What about the monoclonal antibodies that have been out there for over a year? The FDA, the CDC says they're 75 to 80% successful in reducing hospitalizations and deaths. And I can tell you right now, it also brings you around a lot quicker as far as how long you're sick for. So think about this, Jeremy. Right now, this country is, in this area, we're getting hammered with corona. People are sick. They're going to the hospital. And a lot of them who are vaccinated. So what do you do? Why aren't we doing with the corona, with the therapeutics? We might be able to get people back sooner. As soon as you get diagnosed, and why don't we have a whole bunch of therapeutics? There's not enough to go around. This administration dropped the bag on it. They took over the distribution. They own it. They took over the distribution.
I don't know if that's an accurate description of what they did. You're saying they just dropped the bag. Everything they've done is intentional. Dropping the bag sounds like it was an accident. But but they got hold of all the monoclonal antibodies, and now they're like, well, supplies just just aren't what they.
We don't have. Listen, the nurses
used to be.
We're going to talk about the nurses and the doctors. These people are at their wits' end. They're and now.
Well, first off, before you start that, and this is the important thing. Joe Biden, his whole mandate plan. The Superior Court has put the kibosh on it in large part, but there are still some casualties out there, like the health industry. The health industry are not subject to the break in the mandates. In fact, they're probably now, when there's they have fewer people to look at, the healthcare system is going to be hammered by these mandates even harder, I imagine.
Well, here's the thing. It was the Supreme Court. They just came out and basically, I guess the ruling was a couple of days ago that the mandate is not constitutional. And then more importantly, I didn't read the thing, but they're saying it's the health departments. They can't. This comes out of OSHA. Because for employees, there's different agencies that deal with this. But basically, this is a OSHA, which runs, takes care of the well-being of workers. They don't have the power to do this, to say you have to be mandated a vaccine. Right. And they don't do that with the flu vaccine or anything else. The other argument is that there are other vaccines that are mandated, for children, for that matter, polio, MMR, and stuff like that. But this is different. This is a still under, no matter what you want to say, under emergency use. So you really can't say it's apples and apples. And going back to the last part of that is they carved out and said, well, we're going to let the mandate stay for healthcare workers. Now, I look at that and I'm like, so I said, initially, I'm like, oh, yeah. Healthcare workers, are exposed. I'm like sitting here going, wait a minute. This is 2 years into this thing. Every effing healthcare worker has been exposed or has had it. Yeah. And so,
it's almost impossible to not have been exposed.
Right. I don't. And so I don't know. It's just. I think it's just a gesture. But my point is, in actuality, it don't mean a hill of beans, because if you're a healthcare worker, you're going to get corona. We all got corona. You and I got corona. We were vaccinated. We got corona, but to carve that out, I don't understand it. It's either a mandate is not good, not right, not necessary, not legal for everybody, not a certain part of population. Well, so I don't even agree with the Supreme Court. Like, why healthcare workers? Because we're there, we're getting exposed to it.
Here's a hypothetical for
you. We're going to expose it to other people. Everybody right now, before you go, at the hospitals right now, 99% of the people in the hospitals right now are corona patients, and they're and the hospitals are packed.
And you were saying that, you were saying the hospitals are absolutely
if I'm a doctor
packed,
and I want to go in, or I'm a nurse and I'm not vaccinated, if I want to work there, and I've been working there for 2 years treating all these patients, why are you going to force me to get a vaccine?
Well, that's great news.
It just makes no sense to me.
That's great news. I'm just saying. Said about the hospitals, because you hear that stuff on the news, like, all the hospitals are packed up, but for us at home, and we're not in the hospital every day. We don't know what's true and what's not true. So finding out that they are actually being packed, that's great. That's good news that we can trust. At least it's not great news, but it's at least news we can trust. Now here's the hypothetical I was going to give you. Say they take away the mandates for the hospitals, right? And the first response people, all the mandates are taken away. People start to relax in that industry, and then I don't know, someone gets COVID, and they're pointing the finger at the health industry now because they're not playing it safe like they had been the entire time. Can they sue? Like what would be the flack the industry would get if they did lower the mandates?
Right. Well, first of all, if you're working in a hospital right now and you're listening to us, you know it's crazy right now. It's there. It's people are dying, people are sick. So, if you didn't get the vaccine by now, you must have a really good reason. Maybe you're young, you want to get pregnant, maybe you're concerned about that. I can tell you right now, if you look at the statistics, like people over 65, the vaccination compliance is like 99.9999, and and then boosters on top of it. So, you don't have to tell these people. These nurses and doctors have watched people die in front of them. You don't need to tell them they need a vaccine.
That's what I was.
You don't need to mandate it. I don't. My point is, the Supreme Court, it's law. Whatever they're doing, but it makes no sense to me. I'm a common sense guy. We don't need to be told that we need to mandate it. What I want to. So to answer your question, whether someone's going to get sued, you know what? That's the big thing is why? Yeah. Why did I understand?
Well, the people, people in the hospital. Okay. The nurses, and all that.
Yeah.
What's their take now? All right. Put the mandates on the shelf for right now. Are the nurses and the doctors that are in the hospitals every day, would they be wearing this stuff regardless?
Oh yeah, yeah. Listen,
so there's really no need for mandates as far as the masks, because they're all.
You don't have listen. If anything, what you could have done if listen, mandates to force people to get the vaccine will actually help save lives, no doubt about it. Right. Okay. But we talked about it. If you really want to listen, we talked about it. If you really want to make it, if you don't get the vaccine, take them out and shoot them. All right. But here's the thing though. The last group of people that you need to force to get a vaccine are the healthcare workers. If the ones that don't want it, they want it, they don't want it for certain religious reasons, whatever, but the vast majority are going to get them. Well, it's the general population. But hold this one thought. This is where they get it. If you force people to get the vaccine mandates, it will save lives. It works. But that doesn't mean you do that. You can't throw the baby out with the bathwater. You cannot tramp on people's civil rights. So what I'm saying to you is that this mandate, we never should have had a mandate. The administration that's in there now said they were never going to do it. I understand. And here's the thing with all these mandates, right? This whole year, right? Firing people. And they've been doing this. The Supreme Court just backed off, but there's plenty of companies that fired you. So, and now we still have,
the Marines, 500 Marines in good standing were tossed out.
But Jeremy, here's the thing. How effective have the vaccines been? Now, you could say it saved lives.
This is what I was going to bring up. Okay, so we just got this Omicron out. We're coming back.
People dying.
Coming back from our Christmas holiday. How many people out there got COVID for Christmas? Anyone? Show of hands.
Yeah, a lot.
You know what I mean? So now, then we find out that the current viruses, or the vaccines, I should say, aren't up to snuff for this Omicron, and Omicron's ugly stepchild, Deltacron, on the back off there.
Well,
so what's happening there? What are your thoughts about all of that?
Here's the thing: we're consistent in this show. Here's what I said from day one: we should have, we shut down the country for the first, it was March. It came out in March, so March, April, May, June, July. We tried to cut the curve down. We at the same time, what we were doing at that point was ramping up the masks production, the glove production, right? Yeah. Ramping up the production of ventilators, right? Changing the hospitals, opening up floors, getting ready, getting some breathing room. Makes sense, right? Yeah. We shut down the whole economy. A lot of people, it cost a lot of money. Okay. Then we started opening up again. What we should have done at that point too was beef up the therapeutics. Okay. Now the hydrochloroquine and ivermectin, like Joe Rogan took, you could argue that one way or the other. That I think if you give it early, it's not that dangerous. At least you could have tried it. But here's the thing: we do have something that works. It's called sequential multi-drug monoclonal antibodies. And you say right now, well, some of it is about 8 of them, and like say 6 of them are resistant or partially resistant to the Omicron. But they can make new ones. It's made in the lab. It's easy to do. We should have had tons of therapeutics. And it not only will save people's lives, it will reduce hospitalizations, which then reduce the wear and tear on the hospitalizations and the people that are there. And also it'll get you back to work quicker. It's probably will reduce the amount of people who are out of work. So you ask me what I think about the whole thing. I think that it's been mismanaged. We should have had, and still should have, targeted vaccine for the elderly, for people who are obese, for young kids who are obese, whatever, a high risk, we could have a panel, high risk. Everybody else, you want to get it, you get it. Then after that, therapeutics, some level of reality with regard to masks and all that. I go, this thing with the mask getting all bent out of shape. I go to a restaurant. People are waiting outside, right? I was there last week. Oh, they got the masks on. Then we all go into the restaurant. We sit there for 2 hours and eat. And everybody takes their mask off because it's, you can't eat with a mask on. I like sitting there going, that's stupid. The other thing is, ask me.
I know, Mike. We've already learned from the CDC that the masks do not work, and we've got the president. He's trying to rush out more masks, and he's trying to get everybody. Please, it's your American duty as patriots to wear this mask. To wear a mask,
right?
Now, wouldn't it be smarter a mask? No, but see, that's where I get annoyed.
2 masks or 3 masks,
yeah. But I get annoyed that now they have these big quality masks that the hospitals get and for their nurses and stuff. If they were busy making those, that could be easily got by your everyday citizen.
Yeah.
I mean, at least then what you got on your face is working.
Well, here's the thing,
because otherwise you've got these old folks that are pulling at their masks so the wind, the air can come in through the sides, because that's not a hermetically sealed area, Mike, is it?
No. So you talk about masks. I don't think
why aren't the ones that we have?
Well, they don't work either. Here's the thing: when you say don't work, masks work. I mean, if you look at the the commercials for Shriners with the little kids, getting chemotherapy, they have a mask on. I wear a mask every time I operate. But when, like in the hospital, when we do total joints, we just don't wear a mask. We actually have an operating room where we put this apparatus on. We look like we're in it's a hazmat suit with an oxygen, with their own airflow. The room has special laminar airflow. There's plastic on the ceiling that comes down, to reduce the amount of airflow. So
you're like, are you all right, Mrs. McGillicuddy?
So here's the thing: no matter what kind of mask,
I'm all right.
The mask that's really good is they say the N as in Nancy 95 or 94, and it's hard to breathe with them, and we don't wear them in the operating room. We've never used. I've never ever no operating room that I know that I've been in uses a M95. We use the regular cloth mask, with the toe ties in the back.
Right.
And you get flow back and forth. You'll get dizzy. You unless you have a like a scuba tank. So
unless you have your own air supply feeding in,
right.
You're not going to be.
Right. Let me just make a point about mask and first of all, any virus, any virus. If you go Google it, how a virus is spread. Okay, how it gets into your body.
Right.
Okay. It doesn't land on your arm and drill into your skin. It doesn't, I mean, it goes.
No, but this is a good point.
No. So a virus will go into your body, either your mouth, goes into your mouth, goes into your nose, okay?
Yeah.
Or your eyes. That's it. It doesn't go into your ears. Now, maybe it could be sexually transmitted. I don't know about that. Maybe but it's got to get into your body. It's your mouth, your nose, or your eyes.
Right.
Okay. So just think about that. Here you are, and people got these stupid masks. They're moving around. They're touching them. So the viruses say somebody has corona and they got it in their nose, and they're breathing, and it's coming out. It's coming out of their nose. They're coming out of their mouth, right? So it's flaring in the air. Even if they have a mask, it's going to reduce it, but it's not going to stop it. So think about it. Now it's flying all around. Can you see it flying all around?
Yeah.
We should have like a special effects virus flying all around. Now say that I have it right now and I got a mask on, and we're in a room somewhere. That what happens is the virus will settle to the ground, Jeremy. It'll eventually settle to the ground. Now, how long it lasts? Maybe it lasts 10 minutes, on a surface. There's coming out with studies now. It doesn't last that long, but it gets aerated. The air conditioning comes on, the heater comes on, and where does it go? It flies around, hits you in the eyes. So if you don't have a mask on, if you have a mask on, but you don't have a shield for your eyes, like goggles,
right,
you're going to get it. Now, there's studies with the Taiwan and out in Asia when they had their first things with SARS. They had healthcare workers that would wear a mask and a shield. Now, again, if you have a highly infectious patient, I would put on an N95. I put on a hazmat suit. But you can't do that for long periods of time.
Right.
So what we're looking at is a mask has to be worn appropriately. You need eye protection, and you're still gonna get exposed to it. I think the real idea is to minimize the amount of exposure, because not everybody who gets exposed to corona, number one, or any virus, is going to get it. It has to be a certain amount. See, a thing in medicine, when you talk about getting an infection, say you have a cut in your hand, right, and you get exposed to bacteria. We know we can measure, right, a load of bacteria. So you ever see where they say 10 to the first, 10 to the second? That's how much bacteria. You could actually show, there's studies that you need to have a certain level of bacteria, and probably same thing with virus, to get an infection. If you don't have it, you're not going to get it. So yeah, masks could work, they couldn't work. But here's the thing: when you have people, the general population, using that stuff, maybe the mask say it works, but maybe it reduces your exposure by 10% or 20%.
Right.
It's not 100%. Now, so that's number one. So masks, distancing, to me, this thing right now, which is going on, it's ripping through the world. Everybody's getting it. I know during the holidays,
well, here's the big
everybody
question.
I know, and everybody who got it, I know, had the vaccine and had the booster, and they still got. Some people got Delta, I think. Some people got Omicron. I had it. You had it.
I had it.
We all had it.
Yeah.
And I had a booster. And the funny thing is, I had a flu vaccine too. So I'm not saying that people don't get it.
I'm vaccinated. I didn't get the booster, but I did get it. I do have comorbidities.
You have corny morbidity, yeah.
You're Irish.
You're orange.
Scottish.
You're Scottish. Excuse me. You're orange.
Yeah. I've got horny morbidities and whatever. But
wait. Look at.
I got like the fever. I got like it was everything that you could get with this. I got with this.
So again, what are we gonna say? So,
but my next question here is for all the single men out there. Okay, we've been all locked down for so long, and these guys, they're.
I was talking about syphilis.
Yeah, so I know. This is what I'm saying. These guys are looking for some ladies, and the ladies are looking for some guys.
Listen.
So here's my big question: if I've got a mask with my own air supply, and she's got a mask with her own air supply, can we have sex safely without getting the coronavirus?
Yeah, good luck on that one. So I know you're making a joke, but the funny thing is, when AIDS was around, where there was no cure.
A joke. I'm doing God's work for these single guys.
So when I was doing my training and we had AIDS out there, I remember they came out with all kinds of stuff. We were actually, when we were operating, we had special gloves. Sometimes you'd put 3 pairs of gloves on.
Right.
People talked about putting three condoms on. They had these
heard
dams.
about doubling up.
All kinds of things. Here's the thing. What's going to happen? And it looks to me like no matter what we say or do here, this is going to rip through the world. Hopefully, just here's what I'm hoping. I'm no more knowledge. I'm a foot and ankle surgeon. I'm hoping that we all get a level of immunity, and that this virus weans down, and it'll be like a summer, winter flu. Maybe it'll be more than usual. If you look at going back before Corona, the flu would hit us in the United States. You get about 1.7 to 2 million people hospitalized a year during the flu season. I've seen hospitals just like this, booked up like this with the flu patients on bad seasons. And anywhere, 14,000, 60,000, 40,000 people die from the flu.
Right.
And young kids, if you go back and look, 2000, maybe 17, 18 was a really bad year. About 300 kids died from the flu.
Did they really try putting on like 3 condoms and stuff?
Yeah, there was all kinds of stuff. We didn't know when it first came out, Jeremy. We didn't know if it was contact with a toilet bowl. I had to treat AIDS patients, So
you did have to treat AIDS patients.
Oh, I did, yeah. So an AIDS patient, I had a infection in their leg. They got a fracture. And there was dentists that refused to treat them. They're like, I ain't treating this patient, because if you got cut, you die, right? Yeah. And you know what they did? I remember staying in New Jersey, and in a lot of places they would take your license away. I was, we had no choice. If you didn't want to treat these patients,
I know, I'm laughing.
Think about that. I'm not kidding around. I remember that.
No, I know, but I'm laughing about the 3 condoms, because like, what a dilemma that must have been. Look, you're in the moment, And like, should I go through with this, or should I go through the 3 condoms? Because the 3 condoms sounds like Guantanamo Bay level sort of torturing, as far as I'm concerned.
Yeah. Well, with that whole thing, you know, I tell you what it was is that you know, people wanted to have
you're going to get far more blood up there than you want to.
They wanted you basically, you know, if you wanted to date somebody, they wanted to see that your tested was, you know, negative.
Right.
And you know, I tell you, I got tested not because of that, but when I was operating, you know, every once in a while you cut yourself, you know, especially in a trauma case. And, you know, these patients, we didn't know if they were positive or not. Right. You know, most of the time, you know, it's a married girl.
You remember the Greg Louganis thing where he bumped his head, a drop of blood went in the water.
Oh, they went
stop everything.
Right. You know, what we did is if I cut myself, I would ask the patient, you know, can I test you for AIDS? And it was funny because back in the day, you couldn't arbitrarily test anybody.
Did you get kickback from that from the patient? Like,
no, they were
me.
No, they were pretty good, but I don't know if they really had a choice. I mean, if they said no, I could probably force it. But you know, the thing is
harumph.
My point is that it was scary because you know there was no cure for it. And you know, the funny thing is, I don't remember specifically. All I know is I had a bad taste back in those days with Fauci. He was bad, you know. It was allegations that he limited.
So you knew of this cat?
Oh
back when. See, like my introduction to him is just recent history.
No, there was something about you know, there was a patent for the test for AIDS. We didn't have a test for the blood, so we were given transfusions. We didn't know if the blood was tainted. So there was a test, and supposedly he held back on it, and it was therapeutics that he held back on. Here's another thing. Therapeutics again, you know, it had to be their therapeutics, not anybody else's therapy. That was the allegation. I didn't follow it.
Wasn't AZT like not good for them?
I don't know. You know, I didn't research it right now, so I don't want to open my mouth. But I can tell you right now, all I know is that my general impression is that he was a shaky character back then. Yeah. And there was Senate hearings and everything, and I guess they said it was on. But let's get back to our topic. So let's get about this, what's going on right now, and because I don't want to keep beating a dead horse, but you know, so let's go back to the whiteboard. Where is the therapeutics? Yeah. Okay. And that's it. I want everybody to sit on that and think about it, because the hospitals are inundated with patients. People are losing they can't work. They're getting called out. That right now they just closed one of the clinics, wound care clinics, because one of the doctors got corona. Now, and he was vaccinated out the ass. Now, you want to get him back fast, right? Because there's people who need to be cared for their wounds. How about giving him monoclonal antibodies, and maybe, because I've given it to 7 patients. I've sent my patients that I've operated on. They got corona either from the hospital or, you know, whatever, and not from me or anything. But they were my patients. I pushed them right to the emergency room. This was before this last Omicron thing, right. And they were able to get They were able to get it. Yeah, I had one patient, 58 years old, never been vaccinated. He was really 4 days into it. He's having difficulty breathing. I got him in there. He turned around in 12 hours. He said this is what he quote. He was 60% improved within 12 hours.
That's amazing.
Now, my pastor, his daughter, who has Down syndrome, she's 30 years old. You know, they have short stature. They're heavy. She got corona. She was vaccinated. This was around Thanksgiving. She got sick Thanksgiving. You know, about a week later, starting to get bad. Going on the 10th day, really, you know, breathing issues. Chest X-ray showed pneumonia. They were going to admit her, but with this corona thing, with the monoclonal antibodies, once you admit somebody, you're not allowed to get it. Yeah. It makes just trust me. So anyway, they gave it to her. She turned around within 24 hours.
That's amazing.
Yeah. So where is the therapeutic? Specifically, where is the multi-drug, sequential, monoclonal antibodies? Why aren't we making more of them? Why don't we have that stuff coming out of us? Now, when you talk about what doesn't work, I'll tell you what doesn't work, Jeremy. You know what doesn't work? These home tests.
Wait, why don't they work? I know they're not. I know they're not accepted.
No.
By a great many places.
Jeremy. First of all, let's just dive into this.
Yeah.
We're gonna have 500 million. Good luck on that. Right. Time they get out there, it's gonna be over. Here's the thing.
Well, this is something that we didn't actually get to bring across.
No. Look, go to the drugstore. Anybody listen? Go to a drugstore today after the show, and go look at the box that these quick tests, home tests for COVID are in.
The one that I got looked like very, very near a pregnancy test.
Right. Yeah, but
you poke your blood in. If it's one stripe, you're not pregnant. Two stripes, you're pregnant. It's the same thing.
Here's the thing. If you look on the box, it says, this is not NOT, not FDA approved.
Right. Yeah.
Okay, what does that mean? That means that the FDA has no effing knowledge or thought whether or not this is good or bad.
Yeah. Is it working? Did they just make something that reacted?
It's under the Emergency Act. They threw it out. Now, you could be with a test. There's a thing called specificity and sensitivity. That thing, if you're positive, some people say, it's probably 80-90% that you probably got it. If it's negative, who knows? Yeah. I mean, so they're not. They don't. There's just it's disingenuous.
I'll tell you what. Those at home tests for parents, the school system does not recognize them at all. So
there you go. The government doesn't recognize them.
Here's the weird thing. If you all right, and this is what happened to us. My wife's on the phone with the school nurse, and she's arguing with her because she wants our son to have the virtual learning then, if he can't go into school. And she said, well, no, he's not eligible for the virtual learning because we don't recognize the at-home tests. And then my wife was like, well, then I'll bring him into school. I'll just drive him right in. And there was, well, no, because he has COVID. And I'm like, well, that's then he should be eligible for the at-home learning. See, that there's a big, it was a long story, but what it all rounds down to is that they don't recognize the school
right.
At all.
So let's
at all.
Right. So
what is the point of them?
Well,
what is
here's the thing.
What's the point of having an emergency use for them and nobody recognizes
it? Well, let's just go back and say that, because you make a good point, but you're follow that through. Think about that. What's the use of having a test? Okay, let's just say the test is great one. Okay, I just told you it's not, but let's just say it is. There's other ways you could test. You could stick it up the nose, the PCR. But so now, once you are tested positive, okay,
right,
what do? What's the government's recommendation? Go home and wait until you either get better or you get so bad that you can't breathe and come to the hospital. And if we have any monoclonal, maybe we'll give it to you.
Maybe not.
Maybe not. And then you get admitted to the hospital and, ding, ding. That's what we have. That's the best we could do. Let me tell you right now. That's what it is. So now, why test anybody if you're not going to treat them? Now, let me go back to this now. Just hold that thought. Here's what's happening. Right here. Slap in the face. Nurses right now, right? Yeah. They're getting corona. They've been vaccinated because they wouldn't be working there. Mm-hmm. You say the mandate. Well, the mandate the Supreme Court didn't help these hospitals. My hospitals, everybody had to be vaccinated or you're fired.
Yeah.
Fired. They're fired. Okay. So now they don't have those nurses. So now if the nurses get sick with corona, right? They want them back. They want them back in 7 days. You don't want to be tested, and as long as you don't have any symptoms. And if you want to stay out, they want the hospitals. A lot of them want the nurses to use their sick time or vacation times, and they want them to work if they're asymptomatic. Now, these are the same nurses that were holding people's iPads as the people said their last goodbyes to their family.
Yeah.
Think about that. So I want to dissect that. First of all,
you're humanizing something.
Well, wait.
That the corporate mind doesn't understand.
These people, listen to me. These nurses and doctors,
yeah,
they know if they know what the risks are of not getting vaccinated.
What they're doing,
right? But they know
but
let me make a point. But no, that's not the point. They know the risks of not getting vaccinated.
Right.
All right. If they chose not to get it, they had a damn good reason. Okay. That's number one. Right. Don't force them. Now, these are the same, these are the same people, just like me, when it happened in March, the first March, April, May, June, July, August, September, October, November, December, January. There was no vaccines. And we all went in and saw these patients. Nobody said shit to us. Nobody bitched about it. You know, we were exposed. If we got sick, we were sick. We died.
Right.
Okay. But we went in, and we went in the next day, and we went in the next day. I took care. I was exposed to, patients with corona. I'm on call. I went back in. Nobody said you had to. Now, okay. So I was one of the first ones to get vaccinated. Okay. So
you were one of the first to get the booster too.
Yeah. So now there's telling these now now the situation is where everybody's boosted, everybody's is done. We were heroes then. We came in. Now they're firing nurses for not getting vaccinated, or doctors
firing the very same heroes we're talking about.
But also, Jeremy, is that what they're doing now is that there's the opposite now. Now they're going the other way.
Right.
Now they want, they because the shit's hitting the fan. They want you in there. They don't care you wear a mask. They don't want to. If you stay out, they're not going to give you, pay you, help you out. It's there's just this disconnect. There's so many, that's wrong. It was wrong, before to fire these nurses and doctors. It's wrong to mandate people. You can see how this is a total friggin' nightmare mess. So now what do we got? Now we have, and lack of therapeutics, lack of, and anything. Why, a lot of the people who didn't get the vaccine, Jeremy, are minorities. When I remember when Kamala Harris and Biden, I ain't getting that vaccine. It's not my vaccine. That's Trump's vaccine. So a lot of this problem was the politics that got involved. We always said here, get the vaccine. We're not anti-vaxxers, maybe some other shows, but my point is that now you have this thing where the hospital's being inundated. People are dying left and right, and it's not, at least it's not as bad as the Delta. But they're being hospitalized. The nurses, the doctors are out of their wits' end. And here's the other thing. If like the hospitals that are local here are inundated with just all corona patients, what about the people who have cancers that need, who have elective surgeries, who are suffering with, back injuries, diabetic wounds? Who I can't even do now. I can't do elective surgeries. I got 2 memos from each hospital. I got patients who are walking around. I can't, and it has to be an emergent. I have to write a letter, ask for permission.
Right.
And this is stupid. This is United States of America, 2022.
Yeah.
And this is where we're at.
Yeah.
This is where we're at.
That's it.
We're at where we're
take a look around you, folks.
We fired nurses. We don't have therapeutics.
Yeah.
We're pushing away people who, and it is, Jeremy, this is not the first time. This is the second year of this shit.
Yeah.
I thought we were out of this. This is the same. This is actually more people are in the hospital this winter than last winter.
Yeah.
Now, I think the deaths are less. The deaths are less.
Wasn't it his part of his platform was that he was going to get rid of Omicron, President Biden?
Yeah, listen,
not Omicron, but COVID completely.
Right. Well, they'll say
what's going on.
Well, initially they said it's because people weren't vaccinated. Yeah. I think that's
see the vaccines. They put all their eggs in one basket. We need to have a series of things, not just the vaccine, but the monoclonal antibodies, ivermectin, what was it?
Well, they're coming out with a pill. Yeah.
Whatever.
Yeah.
I mean, but we can't throw all our eggs in one little basket and just say vaccine all the time. So the right people that make them are getting rich. We got a country of people whose lives we have to save. This isn't an opportunity to get wealthy.
Right.
This is an opportunity to save some lives, and that's what we need to be thinking about. That's why I really think they should outlaw the ones that own vaccines are being the same people who are pushing them through. It's
policy. That's policy.
No,
right.
Yeah, but policy should be changed. Policy should be changed. It's a conflict of interest.
Yeah.
Well, all right, CDC owns vaccines, and they're the people that push them through and clear them.
Right.
It's a conflict of interest. Whatever changes we're about to make in our country, if any, okay, that's got to be one of the first ones. Nobody can own and control what kind of vaccines are coming out. It's too much of a conflict of interest. Then you're creating people like Anthony Fauci, who thinks who calls himself science.
Right. So let me get back to
no. Do you understand what I'm saying, Mike?
But you can't. I understand. But here's the thing, Jeremy. I agree with you. But this is why the America First movement and Trump was so important. And a lot of people, stop. Listen, but let me finish this point, because you're touching on something, but you're at the lower level. Go up way high and look down. What you have is, you said Fauci. Now Fauci, okay, runs and is the head of the NIH, National Health, Department of National Health. The Fauci is part of the executive branch. You understand that?
Mm-hmm.
Okay. This is a swamp creature. He wasn't elected. He's there for years and years and years. If you look at Peter Navarro's book, he bucked Trump, and he probably bucks Biden, So you got people who have, just like the FBI, the IRS, the CDC, the Environmental Protection Agency. These agencies have their own autonomy. They have their own things that they're doing. And sometimes it has nothing to do with the president. I'm not saying Biden has anything to do or not. It usually, the president, even Trump, who tried to force these people to do different things, didn't do it. If you look at what the CDC and the FDA did with Trump. So my point is that you're making a good point. It may be partly greed. I always think that big pharma, is money. There's also incompetency. It's incompetency. Yeah. But here's the thing. We are the ones on the front lines. We're the ones dealing with the patients every day. These nurses are the ones who are holding the iPads while these people die. I've been saying for years, I like my friend's mom just died about a month ago, and she was elderly. She had really bad heart stuff. She was on her way out. Probably, another few months, or, she having difficulty breathing more and more. She got corona. Wasn't that bad. She was admitted to the hospital, and she was actually doing good, but none of the family could go see her. Nobody could go in there and go to her room. They were waving from the parking lot. They called her up on the phone. And a couple of days later, she had either a stroke or a heart attack and died. But she was on her way. I mean, her heart was weak. It was diseased. And maybe the corona pushed her over the edge. Maybe it didn't. But my point is that why can't we go in there and hold their hands? Why couldn't my friend go in there? He's been vaccinated. He had corona. What we have to do in this country, Jeremy, I'm telling people out there, we need to bring common sense back. We could argue and make, get militant and say, oh, it's, conflict of interest and all that. What we need to do is let the doctors, let number one, let the doctors treat patients. Yeah. If we want to give ivermectin, we want to give, hydrochloroquine, let's make sure that we got, get off this political thing with this vaccine. It's good. People are going to get it. But, unless you take them out and shoot them, you're not going to get everybody to get vaccinated. It's never happened. You can mandate it, but you better have enough evidence. The Congress has to come up. You have to show 6, 7, 8 years, 5, 6, 7 years that this vaccine is safe. We're not there yet. It's still under emergency use. So every parent in this country will get their kid vaccinated if they feel it's safe.
But you say these words, okay, and I understand every single one of them you're saying, right? Well, but questions are going to constantly be propped up, come up with all of this stuff. Like, okay, well, if we don't know and it's only emergency use, the vaccine, then why are we trusting? Why does everybody need to get it? Every single person. I mean,
but Jeremy, see that it's two things.
No. Because President Biden is still saying that it's a pandemic of the unvaccinated.
Right. No.
Why does everybody need to get this thing when we've already discovered now that the vaccine doesn't cover all of these issues coming out? Omicron, Deltacron, the vaccine we currently have does not fight those off.
Well, listen, maybe it does, maybe it does. You don't have to make that argument. See, you don't have to go down that road, because then you're going to get in controversial. Here's the thing.
Well, I don't care. No,
listen, I know, but here's what I would say. Here's the thing. You got two different questions here. And this is what people have to understand. Jeremy, should you get the vaccine, or should you be forced to get the vaccine? That's the difference. You understand the difference? You're asking, should you get the vaccine or should you be forced to get the vaccine? I see a difference. I see a subtle, there's a big difference. In other words, you could sit up there and I got friends who say, Mike, and I believe the vaccine saves lives. I think it reduces your, sickness level. I think that the more risk you are of dying, the older you are, the heavier you are, comorbidities, the vaccine is going to help you. So I think you should get the vaccine. Children, that's another whole thing. But I think you should, and if a child's, high risk, should get the vaccine. That's not, but what I'm saying is, should you be mandated to get it? And that my answer to that is no, because there's not enough science to have a forced vaccine on somebody. People will make the right decision. It's to me, it's the craziest thing in the world to tell healthcare workers. It's a slap in their face. Who else knows better? The nurses who've been sitting there for 2 friggin' years and watching people die, they know how dangerous it is. Now that, the asshole sitting on the street somewhere smoking crack or whatever, yeah, I mean, you should force him.
You do.
Yeah, you should probably force him because he's an idiot, or she's an idiot. But I mean, it boggles my mind. It just boggles my mind. So my point is that when you talk about, does it work? Doesn't it work? What we've been saying for years, and I've saying this, it's going to run through the population. Everybody's going to get it, no matter what you do. And all of this gyrations we're doing is a lot of it is just an academic exercise, makes people feel good. I feel it's bad that this happened during an election. It's sad because it got polarized, it got politicalized, I'm saying. But getting back to what we're doing right now, this is going to peak. I don't know how long, maybe another couple of weeks. It's going to be done, Now, I don't know how it's going to be next.
What's going to be done?
The peak of the Omicron. It's gonna blow through the world. It's blowing through the world right now. The real question is, the $50 million question is after everybody gets it. So people are going to have a combination of vaccinated, they've been vaccinated, they've had Corona. This is the United States now, and also Europe. What's going to be the outcome? Are now people going to be what's the word? Immune to it, or get a simple, get sick but not die from it?
See, we've been saying for a while that when the first time we really heard that the Omicron variant was very low. Yeah, it's got a high transmittability, but it doesn't have the punch as the original coronavirus did. And my thought, and I think Mike agreed, was that getting this particular brand of the virus might be the best thing for us. I mean, because then we're that much closer to herd immunity.
Well, we made a big mistake in this country, and I tell you what the mistake was. We should have let Trump another 4 years. I know a lot of people didn't like him because you got, you have a administration, and it's not just Biden. The whole thing, they have a different tack on this, and they drag their feet. I mean, you can see right now. I mean, there should be tons of therapeutics. They should have had a better marketing for the vaccine. I think if Trump was president, I think you would have had more people vaccinated. You know why? He would approach it differently. You don't go out there, and tell people, you better get it or you're going to get fired. You better get it because I said so. I think it was a bad marketing right off the bat. You don't sell stuff like that. You don't go out there. I mean, you could scare people, but maybe there was a better messaging. I'm just saying, maybe a better. And the therapeutics, we should have been out there. Why were they so adversarial? Even today, they're taking these doctors off the internet for, like Joe Rogan. They want to take him off because he took ivermectin and whatever.
Yeah, he was. They were pissed off because he took ivermectin, and he got over COVID like that.
So but even that. But here's the thing: do they really think that like doctors and lawyers and accountants and everybody are that stupid that they're going to be like, well, they see, Joe Rogan, so I'm going to take it. But I'm a 68-year-old diabetic who has lung disease. I'm going to get the freaking vaccine. I don't care if Joe Rogan had that or not. My point is, though, is this administration, they, in my opinion, mismanaged this whole thing all the way across the board. We should, and again, I think if Trump was in, we would have had therapeutics. We would have had, I think more people. I think the messaging would have been better. There might have been incentives to get the vaccine. They might have done more testing, more transparency, urged and really prioritized testing in children so we could see the results to make it, where parents wouldn't be concerned. When you have companies, the media, selecting out doctors and people who are criticizing the vaccines, maybe, the people from Harvard, Yale, you start saying to yourself, why is the government stopping them from talking? We can make the decision. And then you put that air of, well, what's going on here? Conspiracies start to go. What I'm saying?
You want to talk about conspiracy,
but you see what I'm saying? I think that what I'm just saying is
also with the
but it might not, but hold that thought. It might not matter anymore, because hopefully this is the end of it. Like getting 500 million tests by the end of January it might.
But we're also 2 years in, Mike. Okay, 2 years since this emergency vaccine came out. Where's all the studies? 2 years worth of studies. They're not showing us anything. They're not telling us anything about it.
Well, no, not as good. Right. You really got to dig. Yeah, I know.
2 years, Mike.
Right. There's a lot of right. You know what? Here's another thing.
And no studies.
No,
come on.
There's right. And there's a lot of disinformation on both sides.
But that's what gets mom and pop at home and Joe Schmo. That's what gets them worried, because we don't know what to trust. And we were talking before the show, and I was saying the only truth that you're going to find out there is amongst ourselves. Oh, you had COVID this Christmas. How did you deal with? Oh, you only got a headache through it all. Well, see, I got the fever. And how did your kids? Oh, your kid only had the sniffles, so mine only had the sniffles too. See, the only truth we're going to find about any of this is by talking to each other about it.
So,
and that's what we have to do more of. Because you're also going to spread the word out, and you're going to get people more invested in what's wrong with things. So, yeah, you know what? I talk about the small side of things, because that's what I represent. I
understand.
I represent the audience listening and stuff.
No.
But for us, for the audience, it's going to start small. It's going to start small, where we're all talking about it. We're all going to start, getting a little annoyed and more annoyed, and that needs to happen if change is ever going to occur. And we direly need some change. I mean,
well, it may not.
It's crazy,
right? You know what, Jeremy? It may not. When I treat patients, sometimes just no matter what I do, it's time.
Yeah.
That, and this might be the same thing. It might be just a matter of time with this virus, where it's gonna burn itself out, and it's gonna take how many people. Whether or not we saved lives, I think we saved a lot of lives with the vaccine.
Yeah.
But right now, there's people dying who've been boosted, who've had the vaccine. So it's scary.
Here's another hypothetical. Okay, I'm curious about your take on this. President Trump wins the election. Where are we today?
I think we would have had. I think we would have had. Well, if you go by, look at Peter Navarro's book in Trump time.
Okay.
Their plan, their strategy, which he lays out in his book, was as follows: you get the medication, the vaccines. It's targeted for people who are at high risk. Now, remember, the vaccine can be tweaked. You could make new vaccine and change the DNA, change the bones of it to go after variants. How long it takes and how much money, but you could do that. So that's number one. But so you get that, and you work on thinking about variants, thinking about having the production, cranking. Let me get this back with Trump. Let me just make sure with Trump. Not one person, what I understand in his book, Peter Navarro makes this allegation or a statement, who needed a ventilator and didn't get one.
Mm-hmm.
There's no ventilator shortages. That was Trump. There would be none going forward. So I think that what he would have done is there wouldn't have been any shortages of the vaccine, and the vaccine would have been more applicable, ready for this. I think he would have anticipated this.
Because he was all about having the greatest vaccine in the world.
But they were also with therapeutics. If you look at, they were going to have the monoclonal antibodies, which could be changed. You could tweak them. If you have a very robust system, it's an antibody. So as soon as you get a variant, you could ratchet up the lab and make a new variant. they would have probably pushed for the ivermectin and hydrocodone in early stages. More looking for more therapeutics. It might have put more money into.
We'd have had more choices.
Right. I mean, I read every day. Every day they're saying, I don't know, Pepsid, this, that. I mean, and they're working on it. But I think what this administration did and Trump's administration wouldn't have done is, or they could chew gum and shoot basketballs at the same time. They would have been pushing the vaccine and pushing therapeutics. What this administration did, in my opinion, was push the vaccine, but they were woefully vacant on the therapeutics. So if you ask me what would be different, I think we'd have a lot of therapeutics. Now, whether or not there would have been no mandate, which means people would have been fired, and I think I think you would have had more, this is just my opinion, more people who would have gotten vaccinated, because they would have felt more comfortable because I think the Trump administration would have been showing, here, this is what we got. This is what you do. Now, give you a good example.
So you think there'd be more transparency?
Yeah, but it would have been more saving lives, because here's the thing. In Florida, what DeSantis did, right, was say you didn't want to get the vaccine. So he was giving you monoclonal antibodies, the sequential multi-drug and monoclonal antibodies. And the guy one of the inventors of that technology said you get about 6 to 8 months of immunity or protection, I should say.
Sure.
So, but it's this thing, F you got to get vaccinated or else. Well, DeSantis says, okay, you don't want to get it. I appreciate, whatever reason you don't want to get it, but we'll give you the monoclonal antibodies. Or if you get sick, you get the monoclonal.
Right.
And he had tents up there. We started in this state.
Yeah.
We had it in this state until what happened was hospital, a clinic, you could order the monoclonal antibodies right from the company and get it. Right. The Biden administration put a kibosh on that.
Straight in.
And, right. And you had, and they said, well, because we're running out of it. So they took it over. And I don't know, people, DeSantis made the argument or the allegation, the statement that they're rationing it. So they lost, and so right now we're sitting there, and this Omicron that came up, we don't have a lot of the monoclonal is not effective against it, or minimally effective. So then they say, okay, well, we're not going to give it because it doesn't work, which I think is stupid anyway. I would have tried it, but you see what I'm saying? So if you ask the question, I think we would have had a different outcome. But the 81 million people who voted for Biden, God bless their souls, they saved us from the red man. So, I mean, I think that there's a lesson to be learned, but I don't think even Biden, though, I'm not going to blame everything on him or his administration, because I can tell you right now, the administrative state, the Center for Disease and Fauci, they're a powerful entity, and they got their own idea of what should be done. And sometimes, if you look at this book, Trump time, the president of the United States only could do so much. Just like Biden, he can only do so much. So I'm not going to beat up him. I'm just telling you, one of the things in this country, we have an executive branch that has multiple agencies, they call it the swamp, who do what they want to do. They have policy, and it's not uncommon for one branch of government to conflict with the other. They sue each other. I mean, so that's democracy. But,
well, now people are talking about Trump when he comes back. Is he going to be president, or is he going to be Speaker of the House? Which position would give him the power needed to make the right changes that have to happen?
Well, I can tell you, anybody, forget about Trump, whoever, the people who make law in this country is Congress, the Congress and the Senate. So the legislative branch. All right, the president of the United States could do what do you call it? Executive orders, but they could be changed by the next president. They're not laws. So like when Barack Obama came in, Trump got rid of his executive orders. When Biden got in, he got rid of all of Trump's executive orders.
Wasted no time.
Yeah. Well, that's their right, and that's under the law, But Congress makes the laws. Congress makes the laws, Senate, Congress, and then the president okays it, and then if there's an argument, the Supreme Court could say yay or nay. Right. So that's the way it works. And anybody. And here's the thing: president could change his mind. Congress could change their mind. They make a law, they could take the law away. Supreme Court, they could say, hey, they could make a decision today and change the decision tomorrow. That's just the way it works. So, to be more effective, Well, it would probably be, in the legislative branch if you want to make law.
Right.
That's what. But
do you think there'd be mandates under Trump or no?
I don't think they would have been. I don't think they would have been. I don't think they would have been needed to. I think that politically it was a dumb move. And if you look at when the election was coming out, everybody was talking about no mandates. See, I'm getting back to it right now. Look at the whiteboard here.
Yeah.
The slap in the face. That's an article. The poor nurses. Let me tell you the story again. In this August, I'm in the hospital. There's two nurses that I know. They're both in their 20s. They were both pregnant at the time.
Right.
Now, so that was August. So all of that last year, right? They took care of all of these sick people. They were on the corona floor. There was people dying left and right. They held their hands. They were there. The one girl got corona. The other girl wasn't sure if she got it or not. She might have got it, and I don't know if I think maybe the one girl tested positive for antibodies. But so the hospital said to them, listen, you got until October to get vaccinated or you're fired. And they're like, well, we're pregnant. We're really, we're a little bit shaky about that.
Yeah.
And the and CDC said, oh, no, it's okay. Pregnant women, OBGYN said, okay. So, I'll give the hospital the benefit of doubt. They weren't, CDC say it's okay. But if you really drill down on the, the papers and everything, it was the lesser two evils. They felt that the vaccine may not be safe, but it's a lot safer than getting maybe corona and being pregnant. Gotcha. But the bottom line is, the girl's like, listen, we'll continue to work here. We'll wear a mask. And they were working. They were still seeing patients with corona. What happened in October? They quit. They were like, see you later. They left.
Right.
Two great, and these girls were unbelievable. Now I don't know if they fell somewhere else and worked somewhere else, but so I would say that was that's not the way to go.
That's the thing that a lot of people have to understand. That when these first responders, these nurses, and that have been in the hospital fighting the good fight against this pandemic that's hit us all, they're getting kicked out if they stick to their guns. But you have to imagine how many other nurses are out there looking for jobs. Because they got kicked out. Hundreds of people lost their jobs and are looking for positions, and they're not all going to be finding them right away.
Well, here's the thing. I think if I would have done it a lot different. Like I said, I would have been marketing it. Yeah. I would have made it. I would have said, listen, how about this? You get a vaccine, give you $5,000 off your taxes.
What's wrong with
trust me, they've been lined up.
What's wrong with understanding the nurse's right to choice? Okay. And so that means, unfortunately, we can't have you working in if that's the mandate,
right?
But we've put this organization together to help you find a position elsewhere, something like that. Because you're not what you're doing is you're slapping people's in the face because they have a choice.
Well, but see, now
it's not yours.
The pendulum has swung now. So now they're actually, the Supreme Court's saying if you don't get vaccinated, you can't work in a hospital, and it's a mandate. Now, I don't know how. I don't know really. In my hospitals, all my hospitals, I don't know anybody who's not vaccinated. We're sitting, we're knee deep in corona.
Okay. But in my doctors, surgical centers and with all my clients I have that are doctors, I am seeing patient or nurses that are like, I'm not getting it.
Yeah,
sorry.
Okay, but
I'm not getting it.
Right. But there's a certain amount. But my point is that again, they have their own personal reasons. I don't understand. Again, if you're going to, the Supreme Court's decision to carve out healthcare workers that they need to be vaccinated, as if they're more so because they see corona all the time. They need to be protected.
Because there's no humanity in mandates.
But here's the thing, though. Here's where I'm telling you it's screwed up. Here's the thing. Personally, in my family, so on the other side, there's an aunt. She's 95, 93, whatever. Smokes a pack of cigarettes a day. Refuses to get vaccinated. That's her. Listen,
her choice.
Her choice. She gets sick and dies. I'll go to her funeral. I've had her over the house. I don't give a shit she's vaccinated or whatever. I worry about her. So here's the thing.
Yeah.
Her extended family, kids, grandkids, they don't let her come over to the house. She's not allowed to be there at Thanksgiving, Christmas.
This was a dilemma so many people had over the holidays.
But this is what the nurses are. Listen to what I'm saying. This all ties together. We're thinking the wrong way. Now, to me, 20 years ago, if we were all getting sick and everything, we wouldn't have her over, say, listen, you didn't get vaccinated. We appreciate you have the right for that, but we don't want you to come over because we're afraid you're going to get sick. We're going to give it to you. Even though we're vaccinated and we wear 9 masks and everything, but you're the one who's at risk, right? And you're elderly. We know that elderly people are more risk for corona and dying.
So no Christmas for you.
No, but the reason why they didn't want her over to the house for Thanksgiving and Christmas and other birthdays and all that was not because they were worried about her dying.
Right.
They're worried about her bringing the virus into their house, because, quote unquote, she wasn't vaccinated.
Right.
Okay. Well, now we know that's bullshit, because half the people in the hospital now who got corona,
there's a pandemic with those people,
are vaccinated.
Yeah.
So my point is that the thinking, though, is screwed up. The young people and everybody in that household, by the way, this Christmas all got corona.
Yeah.
9 masks, washing their hands.
Regardless of Aunt Gretchen coming over.
No, Aunt Gretchen never came over, and she never got sick. By the way, she still. my aunt who had corona. It's another story. I'm saying, do you understand? It's just we're friggin'. This whole country's crazy. Even the Supreme Court. You got my aunt. She's 78 years old. She's a little short Italian woman, but had her knees done. She gets corona. Sick as a dog. This is right towards the, I don't know, right when everybody first got it.
So the beginning of COVID?
Yeah, whatever. Yeah. But they actually had monoclonal antibodies. She goes to the hospital. She's a respiratory therapist, or was retired. They're going, listen, you got to be admitted. You're having a hard time breathing. She's like, and she's an old battle axe from the city up in North Jersey. She said, I ain't going, anyway, put me. Right. They give her multi-drug sequential monoclonal antibodies.
Right.
She went home. She had a rough time. She was sick. I was talking to her every day, blah, blah, blah. She made it. She's fine. Now, okay. So, and she's fine. They tested her. She got antibodies out the ass, So, and, she's an old Italian woman. She probably lived to be 110 years old. Yeah. The rest of the family now. But she didn't get vaccinated. She's like, why do I got to get vaccinated? I had the shit. And I don't want to get it. Okay. Hey, I'm not going to. They will not let her go to any of the functions. Right. They actually took, now again, her nieces, kids.
She can't play in the reindeer games.
No, not because they're worried about her getting sick.
Right.
They're worried about an 80-year-old, almost 80-year-old lady bringing it to their house. They're all vaccinated. They got boosters. They got masks. They got gloves.
This is
hazmat.
the new scenario that's being presented to us.
Right, but here's the thing: understand the thinking.
Did we ever have to deal with such a thing
before? And then you know what? This Christmas again. This everybody got, that whole family got sick. Every one of them got corona. So
I gotta tell you something. My Christmas, my New Year's, everybody I knew, every single soul got COVID for Christmas.
Right, everyone. That was their pressure. But here's the thing with her. What was interesting is her family sent her text messages,
right,
belittling her, calling her all kinds of names because you're an asshole, you're this, you're that, because you didn't get vaccinated. And she's like, I had to. So my point is that
meanwhile, poor little Oliver is out in the snow, and he's not allowed in for Christmas dinner, and he's like, please, sir.
Right.
May I have some more?
But think about in the hospital with the nurses. They're treating these patients day in and day out, holding their hands while they die. They say, I don't want to get the vaccine. So why are they firing them? Because they say, well, if you don't have the vaccine, you could spread it to the patients. They're friggin' got it already. And they're going to get it anyway. And then the other side of the coin is, you'll wear a mask. The only thing, but no, I don't hear anybody in the hospital saying we're worried about the nurses dying, or the doctors dying. They weren't They didn't give a shit when this first happened. They didn't give a rat's ass about us dying. So my point is that there's such a disconnect. So I'm getting, anyway.
And okay.
Now you know why I want to talk about syphilis. It's a lot more.
Yeah, I know. Okay, so then.
So you see the dichotomy here.
The virus doesn't help protect against it. but you're not, if you don't have the vaccine, oh, sorry, the vaccine doesn't help you against it, but if you don't have the vaccine, you're not going to get any fruitcake for Christmas this year. I'm sorry, folks. And I mean, that it's just so sad.
Listen, in Europe right now, they're even worse. I hear it over there. They're having riots and everything.
Yeah.
If you're not vaccinated by, I don't know, February 1st, you basically go and get a $4,000 a day fine. It's talk about fascism. Talk about,
talk about the fear that we're living in right now. Maggie got COVID with me.
Right.
I got it first, and then I saw her get it.
Right.
And there was a moment where she looked at me and she said, "I don't want to die."
Yeah, that's scary.
The fear is still, and that fear is a fear of death. That's what the fear is.
Listen, you got 22-year-old kids going into the emergency room right now, shitting in their pants.
Yeah.
So again, we're not. Listen, I think that if the vaccine is safe, everybody should get it, and it's a big if it is safe. I think it's very safe. But my point is though is that we went the wrong way, and obviously it's backfired. It's not working.
Yeah.
And I'm going to leave it with this show. We should have had therapeutics. Again, where is the therapeutics? That's our whiteboard, by the way.
Yeah.
Where is the therapeutics?
Where are the other choices?
Joe Biden. We get a show. Where is the therapeutics?
Right.
And ask, or the administration or anybody, CDC, FDA, where's the therapeutics? The other thing is
not Kamala Harris. Do not ask her. You will just get word salad.
The other thing is that you got this mandate stuff. I'm hoping to God.
I just found out she was a senator. I had no freaking clue. I don't know who this woman is.
Oh yeah,
and somehow I thought her claim to fame was dating Montel Williams. So here's the timeline. You date Montel Williams, you become a senator, then you become the vice president of the United States of America. I thought you had to go to school and shit like that.
Well,
but apparently all I had to do was date Montel.
You have to go to Senate school. Yeah. I like I said, I don't want to get. I'm not going to let you bait me into politics, but no, I'm too tired with that shit. I'm more, but I think it's time where we start looking at ourselves.
Yeah.
And I can tell you talk about personally. I know my life, I think it's the worst thing in the world. See, you got people dying of the coronavirus, but you just made a good point. You said your wife's scared. We got people so effing scared. Number one. Yeah. Number two is the right now, because of all of this lockdown, all of this crazy shit, people are hurting. They're not getting a good example. Go to CDC between April 2020,
right,
and April 2021, 100,000 drug overdose deaths in the United States. God. It was 60, 70, 80. It went down. Trump started to stop the border with the fentanyl. The fentanyl is pouring into this country. But beyond that, Jeremy, people are depressed. A lot of those deaths are suicides, in my opinion. The other thing.
That's quite literally scared to death.
Suicide. Now listen to this.
Is that kind of suicide?
Listen to suicide. Suicide, right? About just under 50,000 people a year die of suicide. I don't know how many attempts, but listen to this. It went down about 2-3% in the past 2 years. The overall suicide rate, which is interesting, but what went up in that box was between a 13% increase in children between 10 and 18 offing themselves. Huh. These are real. This is real shit. Now, what's going on? We're not taking care of the kids. Mental health has fallen by the wayside. Drug addiction is not being addressed. So we have a lot. We're sick in this country right now. We're sick. Not only are we, physically sick, we're mentally sick. We better friggin' wake up. Better wake up because maybe this is God's way of saying, hey, you guys are going down the wrong road. And so my getting back to our thing, we need to, my world, what I see is hopefully this is going to run its course. Right now, one of my patients, I just told you, she came in, 40-year-old, she's 40 years old, she was crying. Her sister is basically, I think they pulled the plug on her. She's 40. Her sister's in her 40s also, got corona, and she's out in Washington State. She's on a ventilator. They're going to pull the plug. So this is no bullshit, but she was vaccinated. Now, I don't know if she had access to monoclonal antibodies. Maybe she did. Maybe she didn't. The point is that, we're in a tough situation right now. Hopefully this is the end of it, Jeremy. And I know you want to get into the politics of it, but we have a lot of ways to look at this. So going forward, you asked me what might, with the nursing, stop the mandates. No, don't force people. Let's get the information out there. Work on the science. Let the people, everybody, don't censor doctors. If they criticize the vaccine, okay, then you go after them in debate.
Yeah.
Debate. So, you get this guy Malone or whatever. Say, I want to get him on, let's have a debate. What's the best way to go? To have one side shut the other side down is not good. We're not going to get anywhere that way.
And why are they being shut down? Because they were practicing their freedom of speech.
Well,
that's the.
It might be, you might be say, I would take another step and say they're practicing medicine.
They're practicing medicine. Yeah. That's a great point, Mike. Yeah, that's a great point.
I mean, if a doctor gives ivermectin, well, I know it's not, FDA approved, but I mean, off label, hydrochloroquine, you're practicing medicine. You're not allowed. I've never seen in my life where a doctor can't prescribe something if they, off label. We went off the rails here. And I think a lot of it had to do with, it got politicized. This happened during a presidential election. And I think we got to say, hey, listen, enough is enough. The 2022 elections will come, whatever's going to happen. But right for now, we got to treat these people. I got a good example. I could go on and on. I sent one of my patients came in the office, right? She was following up. She had some injury to her lower leg. And she's saying, "Oh, my head hurts, and I got this. My arm hurts." So I checked her blood pressure. It was cranking blood pressure. So I was going to send the ER, but she's like, "I don't want to go." And the ER is inundated with corona patients.
Right.
So I called my primary doctor, buddy, and I said, "Hey, can you see her?" And we decided to put her on some blood pressure medicine in the interim. This was like Thursday, and she was going to see them Tuesday. Okay. So we call her in some medicine. They get the appointment to see the primary guy. The primary guy's there. It's a new guy. And he's like, checks her out. He didn't even touch her. He's oh, I think you're having a stroke. So he overreacted.
Right.
That's not my story though. She gets sent to the ER. She's there 4 hours. People are crying, I got to be seen. They got corona, they're all scared. They tested positive. One lady was fine. She went out. She must have been on the phone, and somebody said, "Just go in there and tell them you can't breathe." She walked in and fell on the floor and said, "I can't breathe. I can't breathe."
Right.
So this patient she left in 4 hours. She called me up. She goes, "I can't." She goes, "People coughing, spitting up. I don't have corona. I don't want to get corona, and I don't think I'm." The nurse came out and checked around and said, "You don't have a stroke." The doctor, he said, "Why? Who sent you here?" Oh, doctor. He says, "You don't have a stroke." And she goes, "What are you here? You're wasting our time." She goes, "It's probably going to be 10 hours before we see you. Just want to let you know."
Wow.
So sayonara. Wow. So she comes back. I mean, so that was Monday, Tuesday, Wednesday. I had to get her to my other buddy, interventional cardiologist up at Jersey Shore. So she get a stress test. I mean, an echocardiogram and, blah, blah, blah.
Right.
And she was fine. But we're delaying care. We're in a crazy town right now, and it's not good.
Yeah.
It's not good. So I just, so the last thing we need to do, and then of course you're dividing nurses and but this thing about you're scared of old people who didn't get the vaccine. That just doesn't make sense to me.
Right.
You should be scared about killing them, about giving them the, or your loved one, your father or mother laying in the hospital. You can't go in there and hold their hand while they die. I don't give a rat's ass. I'll take the chance. If I'm 25 years old, or if I had the vaccine, I'll take the chance. They say, "Oh, you're going to spread it." I'll sign a paper. I'll stay home for the next 2 weeks.
Right.
I'll stuff cotton ball up my ass. I mean, my nose, whatever. But don't you understand, people? What's the stigmata, the sequelae, the long-term effects of denying a funeral for your loved one, denying the ability to hold their hand. Where's our humanity?
Right.
Where's our humanity, Jeremy? Where's, I mean,
right.
we're off on this, like we're crazy time.
When I was a kid, I was around 4 years old. I got food poisoning really badly, and they put me in a hospital room, and there was like a plastic partition between me and the outside world, right? And my parents had to come in fully in scrubs with masks.
Yeah,
the hair thing.
Did they have a long pole, long stick?
Yeah, I like to poke.
What do you say? I wouldn't touch you with a 10-foot pole.
Well, no,
that's where that came from.
I was a 4-year-old boy in a plastic bubble sort of thing.
Yeah.
And I couldn't see my parents. I couldn't see their faces.
Yes, and you remember that to this day.
I remember that. Yeah, you remember it because it's devastating to you.
No.
Especially when you're that young, or if you're sick. Or
there's no reason for it.
There's
not. There's not. People say, "Oh no, they can spread it." No, listen. Yeah, you put a mask on, a gown. You limit the time. Again, I don't believe that for a minute. And the other thing that's a big issue. You got guys like Ron Paul talking about immunity. Is probably national immunity might be as good or better than the vaccine. And there's studies starting to come out. I don't want to get into my thing. I don't even have to get into that. That's
right.
The way we're treating each other is crazy. And you talk about our lives. I see it with my two aunts. They were elderly people who had corona, refused to get the vaccine because they didn't think it was necessary. I can understand that. It makes sense to me. They lived all their life. They had the flu, they had this, they had that. Yeah. And they got, there's this thing that's mRNA, they're like RNA, and I mean, fuck that. And so, and they were ostracized as a leopard. It's like, why don't we just take, I mean, it's almost like, really,
you're not wrong,
metaphorically, we put these people at the edge, out of town, and they're still doing it. It's just, I mean, we're going to go out there once in a while and throw them a quarter or something.
My dad, he lives in England. He's got a bad ticker. And so we're always worrying, like, when,
I know. Yeah. You're waiting.
Yeah. And he just got the booster. Before he was talking about getting the booster, I'm like, Dad, you don't go anywhere. You stay in the house all the time. You haven't left the house in God knows how long. Yeah. Why are you getting this?
But see, Jeremy,
where's the protection for you?
Yeah, but see, here's the thing, Jeremy. I understand where you're coming from, but you know what?
Because there are a lot of people still out there that are still under lockdown from 2020.
Right. But I'll throw my comment on that.
All right.
But that's his right to get the booster. If you want to get a booster, you want to get another booster.
You see.
I mean, listen. I have no problems with that. I understand where you're coming from. They get scared, but you know what? It like I had a friends of mine were talking. Their kid, the kid has some congenital abnormalities, and it's probably a good idea for them to get vaccinated. But again, I don't criticize people who didn't get vaccinated. I don't criticize people who gets vaccinated. But I see these people on TV. They say, well, it's personal choices, and you're hurting everybody else. You're clogging up the hospitals and doing all this stuff. Well, that was an argument until this Christmas. And what's clogging up the hospital right now is people who are vaccinated and they're getting sick.
And when you have a forum like this, like we have here, Mike, right? We become influencers out there,
right?
And I want everybody to know that when you hear me arguing about the vaccine and all of that, I'm not telling you not to get it. That's a decision that you need to make for yourself. Anything that you hear on our show,
it's an opinion, right? It's our opinion.
It's an opinion-based talk show about medicine and sometimes politics. But like we always say, this should be the start of your research for you and your family, not the beginning.
No.
You have to take our show like it's a buffet. You take what you want and you leave the rest.
So I tell you what, and when we're wrong, we're wrong, and we'll correct ourselves.
Yeah.
Like it looks to me like now that people are getting corona a second time, maybe the third time.
Yeah.
And my infectious disease doctor told me that about a month ago, and I said, well, there's some research saying that that's not the case. So I think that is the case. But and nobody's sitting here. We don't say don't get the vaccine. I'm not an anti-vaxxer. I think where the controversy is in this country, I could see it, is with the parents, with the young children, 5-6-year-old kids. But the parents need to be the government and medicine. It's not even the government, but the attorney general. I mean, not the medicine per se. They should be showing the evidence but letting the parents make the decision.
Sure.
You see, and I know it gets more complicated because the kids go to school and they didn't get vaccinated. Then the teachers,
100% agree.
But then the teachers are concerned they get sick, so it becomes illegal. Yeah. And then not only medical, you got legal. Like you said, lawsuits, all of that. So it gets really complicated. But we have to start understanding that we're beating each other up, right. and these mandates, and we have to. I think especially the government appreciate and let the people make their decisions.
Right.
If you're a school teacher and you don't want to go to work, then don't go to work.
And you know what? For the school teachers out there,
and they should pay them. They should pay them if they decide not to go, then stay home and we'll pay you. Until this is all over. Like these nurses. If they get sick, I know you want to bring them back in. Which, okay, I could give you the argument. Fine, let them come in if they're asymptomatic, but pay them. Or if they want to stay out, right. You don't make them take sick time and vacation time. These are one time they're heroes. Now they're not heroes. Yeah. So we need to start treating everybody respectful. Oh, I was watching the one thing. Now I don't know how true this is. It was on one of the I think it was Steve Crowder's show. A guy had his kid at Ronald McDonald House.
Right.
So I don't know what the kid was getting treated for, but probably some cancer, right, or something. And they sent out a notice that everybody in Ronald McDonald House, if you're not vaccinated, at least have one shot by February, you're out. And I think the kid was kind of young, maybe 6 years old. I don't know, 7. Again, I don't know the story per se, but this is how it's getting. This is cuckoo for Cocoa Puffs.
It really is, man.
Now you could say, okay, that kid should be vaccinated. Maybe because if he's not, he could spread it to other. But I mean, they're sick to begin with. So I think so. Now again, the old saying, you're throwing out the baby with the bathwater. So this kid doesn't get vaccinated, and maybe it's not a good thing for him to get vaccinated because of his other comorbidities, or right. Maybe it is. But to force him to throw him out of there, now they're probably sitting there going, "Hey, listen, we have a policy. We're concerned, liability." Yeah. So these are the things that are happening.
So let's sum this up now. What we need to, as the audience, as the people at home, your Tom, Dick, and Harry, and Jane, of course, we need to talk about this stuff to each other. We have to support our nurses who are on the front lines, and they're not getting a lot of thanks for this job that shouldn't be a thankless job. Also, we are our police officers, our boys in blue. We have to support them. Our teachers, we have to support them. Currently, I'm sponsoring on WJRZ and the Rat, Teachers Who Rock. And so, for any students out there, if you have a teacher who you think is special, does above and beyond. He's, and we all have those special teachers we remember our whole lives. You can put their name in, write a little thing about it, go on WJRZ or the Rats webpage and send it on in, and nominate your teacher. It lasts for about six months, so you can have a lot of fun with that.
Good, Jeremy. So we're going to sign off here. Let's we're going to start ending this. Jeremy, how about we do this? How about you? So I'm Dr. Michael Kachmar, and I'm a board certified reconstructive foot and ankle surgeon, doctor of podiatric medicine. And again, this is an opinion show. So we get passionate about things, but I think today we really didn't, we talked more about, just how things are with human being interaction.
I was pretty much under control, wasn't I?
Yeah, you were good. I don't want, so, if you want to get a hold of us, it's, you could send us an email at drkachmar@icloud.com. For the people on our podcast, just go to our, what do you call it? People who are on our podcast, go to our video, YouTube video or Facebook. We're on Facebook. We're on live, YouTube live. We're on Twitch live.
You're on YouTube though, and I don't know how Twitch is, but subscribe.
Yes.
Okay. And then turn on that bell notification thing.
Yep.
So you always know when we're doing a live show.
My
For more information about Dr. Kachmar and all the wonderful things we talk about on our show, you can always go to JerseyShoreFootAndLegCenter.com. And there's some vitamins, which are very important now. When I had the COVID, I called up my friend Dr. Kachmar, and he gave me a list of stuff that would be good, like vitamin D, zinc, melatonin 10.
We have a web page. If you go to my web page,
but you can get all the good stuff from Jersey Shore Foot and Leg Center. All these vitamins that Dr. Kachmar approves of are right there. Get them. They're isotonic, so it's not like taking a pill and you're wondering how well this pill is actually going to do for you. The isotonic way of taking vitamins is it's a liquid-based thing. You drink it down, and it goes right into your system, right away. So please go to Jersey Shore Foot and Leg Center and check that out.
Yeah, when you go to the webpage, you go to Nutrimetrics. There's a banner. You could say order. We have some stuff there. Getting back to the other thing, Jeremy. So just so you know, we are on Twitch and Twitter, which is they're live, and people want to see that. We have these archives. The other thing I wanted to mention is about you, Jeremy. You're going to be doing a show tomorrow.
Yeah, tomorrow I got 2 shows actually.
2. So okay. So why don't you tell everybody about that, and then
I have
you do 2 shows, right?
Yeah, I have Painless with Dr. Gabriel Jasper. That starts at 10 o'clock on local radio 104.1 FM. We're going to actually have a special guest on tomorrow, a Dr. Ronald
McDonald,
Iannacone, and he's a sinus doctor and stuff. You can just write his name down and do a search for him. Ronald,
that'd be good. I know him.
Iannacone, yeah. He's I haven't met him yet, but
he's an ear, nose, and
throat guy,
ear, nose, and wallet doctor.
Is that it?
that's what Johnny Carson, Dr. Vitamin Gumbats. He's an ear, nose.
That's what do you call Dangerfield?
Dangerfield,
yeah. So that's my 10 o'clock show. At 11. I'll be with Dr. Barbara Schneider, and we're going to be doing Radio Free Tom's River. This is our heavily political talk show, right-wing based. If you want to just vent by listening to something, this is the show for you.
She's kind of,
and we haven't actually done a show for about 4 weeks, so she is chomping at the bit. I saw her Wednesday. We sat down. She told me a little bit about what she's got ahead of us, and I was like, oh boy, I cannot wait.
Well, Barbara is, just to fill in her background, she's a premier breast surgeon.
Yeah, reconstructive surgeon, general surgeon.
Yeah, she's been around a long time, so she deals with a lot of breast cancer. So
she just beat cancer herself. Prostate cancer.
No, not prostate. She's a woman.
Well, what was it then? I have no idea.
I know you don't.
I have
colon,
no idea.
Colon
cancer.
She may not want people. Well, she says on the radio, right? So it's
Wait, girls don't have a
well, no, they don't get prostate cancer.
Really?
Yeah. No,
do they have one?
Probably a small, but no. I've never heard of a woman getting breast cancer, but I've heard men getting breast cancer.
Nothing to write home about.
I haven't heard of women getting prostate cancer, but I've heard of men getting breast cancer.
Oh, we'll see. Chest cancer now, Mike.
No, breast.
No.
Oh, chest.
Oh,
is that what they say? Chest.
You know what they're calling babies now? Babies.
Babies.
I'm not even kidding. That's a real thing.
Well,
all right. So
listen, that's enough. We could go. We could go here for 3 hours. I mean, listen, I don't want to. Listen, everybody have see Jeremy on the radio.
Yeah.
As they say, hear him on the radio.
Yeah.
We'll be back here next week, Friday. We're sorry. We did actually a show last week and we had technical difficulties.
Yeah,
so
we lost it got
sound.
Corrupted and we lost the sound.
But this time we checked it and everything's going really well. And we appreciate you guys listening to us. Send us an email if you want us to talk about something. Next week, just to let everybody know, I know it's going to be a little bit dry, but I'll make it exciting. We can talk about syphilis. we need to talk about some, and I want to talk about gout. We're going to talk about some medicine.
I got the gout.
Yeah, but these things we try to throw these things out because it's interesting, and every once in a while we got to get some medicine out there because these things are serious, and it's the reason why we bring up the syphilis is it's raising its ugly head again, and it's a public announcement. We need to be tested. People need to be tested for that. It's an easy blood test. So you got to tell your primary, hey, when you go for your yearly blood test, get us. It's doesn't take anything really. I mean, it's you're giving the blood anyway, so a little bit more, and you get some information. And if you're positive, hey, you get a dose of penicillin, and nobody's for the wiser.
Right.
So really, you can save yourself a lot. Anything else, Jeremy, you want to talk about?
I think we kicked this one in the butt.
I think that we want to say goodbye. Come and visit us. If you want to call my office, it's 732-269-1133. We're in Bayville and Barnegat. Jeremy, you're going to say goodbye to everybody?
Listen, everybody, take care, be safe, and try to be kind to each other, would you? We love you, and we can't wait to see you next week.
Yep.